My name is Dr. Mwila. I'm the head of Department of Obstetrics and Gynecology at Mainasoko Medical Center in Zambia. I'm a consultant obstetrician and gynecologist and a fertility expert, having trained at Indira IVF in advanced assisted reproductive techniques and reproductive medicine in 2021. So in terms of the training I received at Indira IVF, two things among many stand out. The first is that we had hands-on experience in ultrasound sonography, a component that had been missing in our training. You would imagine that up to the time that I trained as a postgraduate student, we didn't have much exposure to ultrasound training. So at the time that I went to Indira IVF, this was one of the things that was done on a daily and routine basis, and that has made a huge difference in the practice of obstetrics and gynecology, and particularly fertility in this case. The other aspect is that, again, up until I went to Indira IVF, my knowledge of what causes infertility and how to evaluate it properly was not as good. So the course that I attended at Indira IVF made it very easy for me to be able to appreciate what constitutes causes of infertility, how to evaluate them properly, and how to treat the patients well. I found the faculty well-rounded in their knowledge of fertility. They had all the time for us. They taught us well, and they were practical. So it's not a question of people speaking, but demonstrating how things should be done. I think those are some of the things that stand out about the training that I received. So upon my return from India, I embarked on a program to try and establish a formal infertility clinic at my hospital. Because before then there was none. We would basically just see patients, infertility patients, in the same way as we did see the ordinary gyne patients. So that clinic now is running fully, and on a weekly basis we are seeing these patients who are struggling with fertility issues separate from the general gyne patients. This clinic has been running since 2021 when I returned from India, and it has grown. We are seeing more and more numbers. Further, like I did mention earlier, I think our knowledge of infertility was poor. But now, because we know how to properly evaluate infertile couples, we have gotten to a point where the numbers have grown, where they're spread out there, and we're getting more people coming to seek help. And now they are finding solutions to problems that have afflicted them. I'm privileged to serve as the internship coordinator, and so I coordinate the training of young doctors at our hospital. For that reason, it puts me in a privileged position now to influence the inclusion of fertility package in what we teach the junior doctors, so that, unlike in the past, all those that pass through our departments now are able to evaluate infertile couples in the proper way. So that's one aspect that has been positive about the training that I received, that now we're able to pass on correct knowledge in terms of diagnosis, investigation and treatment of infertile couples to our young doctors. Further, it should be appreciated that the results are now better for our clients, because unlike before, we would order all things including hormone profile and scans and everything, but these would just be general, without answering to the proper way of doing things. So the impact has been immense, and I think the results have been very positive. I would actually refer colleagues without hesitation to go and do this course. And for the information of the general public, I do this routinely. because I have seen the impact. We are serving in a place where there's so much stigma against couples that are having challenges with conception. So what we note is that couples that are impacted negatively by these fertility issues have difficulties where to find help. And therefore, I've realized that it's important that I have, beyond myself, many others that are able to dispense the correct kind of treatment to these patients in need. And so I would not hesitate to recommend any colleague to come and do this training. And like I did say, I do this nearly all the time to colleagues. I'd like to say thank you so much to Merck Foundation for the opportunity provided to me to study this course. The impact has been very, very positive, and I wish that this program continues so that others benefit as well.